Thank you so much for having me today. Hi, everyone. I'm Dr. Christina Blacher. I'm coming to you from Dallas, Texas. I am a general dentist just outside of Dallas. I have a very, very small 4-op practice. I have one hygienist, one assistant, 2 front desk. I work out of 2 columns. I have a production column and I have a non-production column. But it doesn't matter what size practice you have, you are all capable of doing some incredible things. Now, my thing is Invisalign. I absolutely love Invisalign. I actually teach and mentor and inspire other dentists on Invisalign. I created an Instagram page at Queen of Invisalign that I literally post everything I've ever learned on there. So I love connecting with people that way. But I do about 130 Invisalign cases a year, even in my small 4-op practice. So I want to share with you my clinical tip of how I do that. What is my one secret that I changed to get successful with Invisalign? Now, my clinical tip is Invisalign is not a cosmetic procedure. It's not. It is not an aesthetic procedure. Invisalign is a clinical procedure. You have to change your mindset on thinking that way, and it will totally change your practice. So in hygiene, in the past, I used to go into hygiene and would look for 3 main things. I would look for restorative work, I would look for decay, and I would look for perio. And that's it. And what I realized is I was missing a ton of other things that we see every single day. And all these things can ultimately lead us to having an Invisalign conversation. So let me give you a couple examples. Abfractions. I used to see abfractions and I was like, oh yes, buccal composite, easy. I can do that right now. But what we forget is abfractions is actually an occlusion issue. If you have a tooth that's biting down and you have any horizontal forces, it's going to cause the tooth to flex. And when that tooth flexes, that is what causes an abfraction. So now if I see an abfraction, I'm like, something's going on with your bite. We need to talk about your alignment and we need to talk about Invisalign. Wear is another one. I used to see wear and I would slap night guards on everybody. But I now have the conversation with my patients. Do you want to address the symptoms or do you want to address the root cause of your wear? And the root cause is your alignment. We see fractures around amalgams every day. We see people having what we call traumatic occlusion. Anybody that has a bad bite, I don't want to see heavy contacts on anterior teeth. I don't want to see uneven contacts on posterior teeth. We utilize our iTero scanner in order to show us how somebody's bite look like, but that's the number one reason we do Invisalign. We actually will show patients areas that they're hitting heavy and we will say, I do not want these teeth to break. I want to prevent you from spending thousands of dollars in the future on crowns and root canals. And so let me prevent that from happening to you by aligning your bite. And the way we're going to do that is actually through Invisalign. We even see patients who have crowding. We know crowding leads to periodontal disease. And I always ask my patients, do you ever have trouble keeping that area clean? And they all say yes. And then even airway, even if you haven't dove deep into airway yet, all you need to know is if you can expand somebody's arch, you can make room for their tongue and you can improve their airway, and that will improve their overall health. And so there are so many things that we see every single day that can lead us to having an alignment conversation, and it can lead us to talking about Invisalign. And when I changed this in my practice, I started seeing 95% of all the Invisalign I do come out of hygiene. And it's all for those clinical reasons. The aesthetics, they're a bonus, but Invisalign is not a cosmetic procedure. It is a clinical procedure. And that is the one thing I changed that changed my life, that changed my practice. And I am so happy to be able to share that with you. You just have to change your mindset around it, and you will start to see Invisalign on everyone. So hope that you enjoyed my clinical tip. And Gary, I used to see you at Midwestern. I went to Midwestern for dental school. And so I used to see you speak about marketing and business, and it's come full circle now. So thank you so much for having me. I hope you enjoy the rest of your day.